Well, I thought we'd just go ahead and jump on in. When I was first asked to do the webinar, they provided me with the title, and basically I wanted to just bring up some new findings in the last several years. All right, so I kind of like this little slide. This is kind of what we think of when we have hyperactive kids. As a general pediatrician, but also a certified functional medicine physician, I want to present from the pediatric standpoint and also for any primary care providers, but therapists of any kind, acupuncture, massage, chiropractic, nutrition. We know that all of these modalities work together to help us care for these children and adults with attention deficit disorder. So by the end of the webinar, you should have a basic understanding of the 3 types of attention deficit hyperactivity disorder recognized by DSM-5 and their diagnostic criteria. And since approximately 2015, our understanding of ADHD has changed, and that neural inflammation is now recognized as the most significant driver that leads to micronutrient deficiencies. You should also recognize that the treatment of predominantly inattentive ADHD versus predominantly hyperactive impulsive ADHD are different. You should be able to understand the common micronutrient deficiencies associated with this and understand the basic functions of dopamine, glutamate, and GABA. Have an understanding of the basic dietary guidelines any person with ADHD should follow, and have an understanding of the basic non-toxic lifestyle guidelines for anyone with ADHD. I like this quote. It was by Sir William Osler, who was one of the 4 founding professors of Johns Hopkins. The good physician treats the disease. The great physician treats the patient who has the disease. So that's how we view. We are treating people who have a label. And we're not into labels, we're into root causes. I love this slide. I borrowed it from the Institute for Functional Medicine, but as you all know, we have a tsunami of chronic disease sweeping over us. And I think right now the folks are determining or are realizing that we're just going to be trying to manage chronic illnesses in our healthcare system. But what we want to do is prevent it. Now, there's been a paradigm shift, and so in the 1950s, kids were mostly healthy, and then again in the late 1980s, there was an inflection point where children were developing chronic illnesses, and it's just continued to escalate. And I'd like to just kind of go into that a little later on. Now, these are some of the things that we typically think of. Now, on these slides, I put the references that have, unfortunately, they're very, very small. But for girls tend to present with ADHD symptoms with daydreaming, inattention, fidgeting, talking excessively, and I'll just let you kind of look through there. Boys, you tend to see them being easily distracted, poor concentration, losing or misplacing things, poor attention to detail, and so on and so forth. All right. I wanted to also provide you with some various references for attention deficit. Dr. Daniel Amen has provided several great references here, and I have another slide that has all of these listed. The other reference page that these are great references. They're by Liz Lipsky, Digestive Wellness, and then Digestive Wellness for Children. Excellent resources. And then these are all listed here, and you'll have access to those after the webinar. All right. So I wanted to go over some basics. You should never forget them. So just an overview. Kids have to sleep, and so do adults. You can't heal, you can't grow, And how well do you pay attention when you haven't had any sleep? We also need lots of water. We need to be able to remove toxins effectively, and there really shouldn't be a lot of sugar. It's a toxin, and it's inflammatory and drives hyperactivity. You should have clean food, basically anti-inflammatory, organic, non-GMO food plan. Okay, so as far as sleep goes, this was published by the American Academy of Pediatrics. So these are the hours that children should normally sleep. And basics are you should have a dark room, should be cool, there shouldn't be lights. There really shouldn't be any screens for an hour before bed to block the blue light that stimulates the pineal gland. We want to be able to make melatonin. Kids should empty their bladder, and if they need something that's comfortable, let them have that. And to de-stress so there's no anxiety, just be prepared, have clothes laid out, lunches, snacks made, and have a nice, relaxing routine before bed. And if a kiddo is in multiple activities every night of the week, you really should block that and just limit it to maybe one thing. We need the restorative sleep again to grow, heal, learn, and pay attention. Water. Here are some guidelines on water, but basically you take your body weight in pounds divided by 2, and that's the number of fluid ounces you should drink in a day. You should have clean water by reverse osmosis or use a big Berkey, which is I spelled dechlorination wrong. It's DE instead of DI, and defluorination filters. And if you use RO water, you can add trace minerals back into the water. And I put a little link there about concentrates trace mineral drops. Okay, and we've got to talk about getting rid of toxins, but we know it's not just going pee and poop. I like to tell kiddos and show them this part of the pediatric Bristol stool chart. You basically want to poop snakes 1 to 3 times a day that sink to the bottom of the toilet. Types 3 and 4 are considered normal. All right. So DSM-5, Diagnostic and Statistics Manual, was published in 2013, and they basically changed the clinical definitions and criteria a little bit. So instead of having ADD, ADHD, everything falls under the diagnosis of ADHD for the most part. So for coding purposes, if you provide patients with super bills, or if they have a health savings account and they want to submit it for out-of-network benefits, if you're a cash-only practice, you can still use attention and concentration deficit if you don't want to go in and assign a specific type of ADD. So this ADHD is a neurodevelopmental disorder, but it is also a neuroimmune disorder because it affects the neurologic system and the immune system. So we also know that there are particular genetic variants that lead to the various types of ADHD. So according to DSM-5, there's the predominantly inattentive, predominantly hyperactive impulsive, and the combined type. And if you want to go into a bunch of details, you can always go to this link on the CDC. It's very easily Googleable. And there is one FDA-cleared device that's used to assess the core symptoms of ADHD. It's called the QB test. There used to be one called the Quotient, but it is fading out, and the QB test is fading in, and it takes about 15 to 20 minutes, and it's reimbursable by insurance. Basically, you set a kiddo at a desk, and you put a probe on their head so that you can see how they're moving, and their hand is also checking marks. And so this is not a very good illustration of this, but it's basically you can see at the first little illustration on the left of the screen, towards the top, just under the writing, you're looking to see writing that's more toward the center. But as you move out to the right, it's scattered all over the place. So there are errors of omission and commission, but this is one way that you can show inattentiveness, hyperactivity, and impulsiveness. And once a child is on supplementation, receiving neurofeedback, any other modalities, body work, acupuncture, learning how to exercise their vagus nerve to relax, then you can do another test to show objective changes. And of course, our allopathic colleagues would be looking, and I have to admit, I do use some medications for some people with ADHD, but it's not my norm. So for those few prescriptions that I do write, this would be one way that you could show improvement on a medication. Now, the predominantly inattentive type, this is not what most people picture when they think of someone that's hyperactive. So adults and children usually respond very well to magnesium, zinc, activated B6, which is pyridoxal 5-phosphate, not plain B6, which is pyridoxine or pyridoxal. And anything that will modulate what's called the NMDA receptor. And I'll go into that in a little bit. Most people, children, adults that have this have a really hard time with organization and paying attention. These are usually quiet individuals that are not disruptive and active. Little girls struggle with this much more and are identified later in life than boys. Boys are, since they don't draw as much attention to themselves. So many times they'll be struggling academically, their grades will drop, then they have an evaluation that reveals ADHD, possibly some learning issues and challenges and disabilities too. A lot of these kiddos have a deer in the headlights look. They seem not to listen when spoken to directly. It's when you look at a kiddo and say, John, look at my eyes. This is what mom wants you to do. And you have them repeat it back to you. But then they go off and do something and they get lost in the process. And they look at you, you ask them to repeat it, and they say, Mom, I don't know what you just said. They literally have brain fog, just cognitive dysfunction. There's just a disconnect. So they have trouble focusing on the task at hand, can become bored quickly, and become confused easily or daydream frequently. A lot of times they'll have difficulty completing homework or lose items needed to stay on task. Even when you make a little laminated list and put it on their backpack or you have it on their mirror in the bathroom, they miss details, become distracted easily, and just have trouble learning and organizing new information. They also process information more slowly and make more mistakes than their peers. So if you can identify this early, then these kids, our public school systems are set up for our kids to fail before they receive help. So if you can identify these kiddos early on and then help them, supplement them with the proper nutrients to overcome their genetic variants, where they have nutritional deficiencies because of those, it's amazing where you can send them so that they don't end up having major self-esteem issues and feeling like they're dumb, and they start comparing themselves, and it's just a horrible cascade. Now, the predominantly hyperactive, impulsive type of ADHD this is usually what we think of. These kids usually respond well to stimulants. Of course, I recommend supplementation, but keep them in the arsenal if you're really desperate to turn them around. So these are usually the little first or second grade boys that you think of. They can't sit still. They're moving around. They're chatty. They're tapping their feet, they're chapping their toes, they're making noise, they look out the window, they blurt out answers. So fidgeting and squirming, trouble sitting still, doing quiet tasks such as reading. They run from place to place, acting like they're driven by a motor, leaving their seat, jumping, climbing on furniture or other inappropriate places. They don't tend to have patience. They blurt out comments at inappropriate times. This is a really good way to think of the kid with no filter or the adult with no filter. Interrupt conversations or speaking out of turn and trouble waiting for a turn or standing in line. Okay, so why do some people do very poorly with stimulant medications, and why do some dopaminergic drugs work for a while then stop? And why does GABA seem to work for a few days then stop working? And as functional medicine practitioners, we know it's wise to avoid monosodium glutamate and the other names that it goes by, such as yeast hydrolysate. But why? And the answer really lies with genetics. We really need to know about neural inflammatory and neurotransmitter genetics when treating patients. And the micronutrient deficiencies follow the genetics very nicely. Also, if you are treating patients, I think it's always wise to do pharmacogenetic testing. There's a lot of really good companies that can do this, and we can talk about that later. All right, so concepts for healing. For healing to take place, you really need about 5 components. The first is control and eliminate inflammation. You've got to put out the fire. If you can't put out the fire, then you're not going to be very successful moving forward. Second, you really need to address autophagy. And the Nobel Prize was won for autophagy in 2016. It's essentially the ability to clean out intracellular garbage. It's different than detoxification of the whole body via the liver, kidneys, skin. If you cannot undergo autophagy, then you build up intracellular debris, intracellular toxins. And this is at the basis of any neurodegenerative type of an illness. It's also at the basis of any cancers, anything that has to do with insulin resistance, such as type 2 diabetes, polycystic ovary syndrome. So autophagy is also what the intermittent fasting is about, and prolon, which is the fasting mimicking diet. So I encourage all of you to get a hold of the book by Dr. Walter Longo, which is called The Longevity Diet. And he talks about autophagy when he talks about the intermittent fasting. The third thing that you need to do is deliver necessary nutritional elements, so methylation and micronutrients, and that's addressed about 4 to 6 weeks after you've addressed inflammation. Because if you try to pour in gas, which is methylation, it's like fire, and you already have a burning house. So don't pour it in initially. That's where we kind of hear the misnomer of overmethylation. Well, I tried to do this and I got worse. And it's usually because you haven't dialed down the inflammation enough. All right. And then you want to have proper cellular energy, the mitochondria, provide the mitochondria, and you want to be able to detoxify globally for your whole body well. And then you want the patient to feel good enough to function during this entire process. So it's paramount to keep these kids and their parents and adults that have ADHD comfortable. So we're going to talk a little bit about neural inflammation. So we have neurotransmitters versus inflammation. So a frequent complaint of parents is that their child can be so good one day, then behave so poorly the next. So everything that we ingest and are exposed to changes the levels of inflammation in our brains and bodies minute by minute. So how do you identify neural inflammation? Basically, you just ask the patient or the parents, do you have good days and bad days? And if the answer is yes, then that means there is inflammation. All right. So inflammation in our body fluctuates very rapidly, whereas neurotransmitters fluctuate more slowly. A person may become manic in a short period of time, but we really have to chalk this up to neural inflammation. But when you think of depression, you think of building up to major depression. So now that we have genetics on people, along with how those genes are expressed by their clinical presentation, we can target those inflammatory variants and predict behaviors. So we know that the ingestion of lipopolysaccharides, or LPS, can cause changes in the brain within a number of minutes to hours, as visualized on PET scans. And so what's a SPECT scan and what's a PET scan? A SPECT scan is single photon emission computerized tomography, and it's a type of nuclear imaging test that shows the function or physiology of the brain and other organs. And Dr. Daniel Amen, who's an integrative psychiatrist in California, he's performed over 31,000 SPECT scans as of January 10th, 2018. A PET scan is positron emission tomography, and it basically helps reveal how your tissues and organs are functioning, and it uses a radioactive tracer. So the main difference between a SPECT scan and a PET scan is essentially the type of radio tracers used. In 2015, our PET scanning abilities changed drastically. So our understanding of what was going on with ADHD changed too. So in 2015, we were able to image the brain's immune system. And the brain's immune system is composed of microglial cells. They run around the brain, they're very active, and they have these long dendritic ramifications is what they're called. It would be like a 3D picture of kind of like a spider that is reaching out, cleaning up debris in the synapses. There are microglial type cells in the gut and the liver, such as the Kupffer cells of the liver, and they do the same thing. So this is a PET scan showing a picture of an individual who ingested lipopolysaccharides, and within minutes to a few hours, you can see how their brain lights up, the inflammation in the brain due to the ingestion of the lipopolysaccharides. Now, this next slide, I'm going to show you an image of microglial cells. So on the screen, you can see the letter M. So, Jessica, I'm trying to see the audience view. I guess it's loading. So what you'll see is this is a tissue culture of neurons, and there's oligodendrocytes and astrocytes, but the microglia being the immune system. Is it playing or not? There we go. Okay. So you see the M towards the right side of the screen as it's moving around. That's a microglial cell. And like I said, if you could see it 3D, you would see the little dendrites everywhere. And then up in the top, you see another microglial cell. And there's literally lysosomes inside of that eating up the debris. And that stuff in there undergoes autophagosomic activity. So you chew up the debris. So the microglial function is really critical. Okay. And so this this is from a quote. It said, the results from our study confirmed that people with ADHD have differences in their brain structure and therefore suggest that ADHD is a disorder of the brain. We hope that this will help to reduce stigma that ADHD is just a label for difficult children or caused by poor parenting. This is definitely not the case, and we hope that this work will contribute to a better understanding of the disorder. All right, so neural inflammation. This is a quote by Dr. Stephanie Seneff, a researcher at MIT, and she said that by 2025, half the children born in the U.S. will be diagnosed with autism. And she said, is there a toxic substance that is currently in our environment on the rise in step with increasing rates of autism that could explain this? She asked this in a 2013 presentation sponsored by the Wellesley League of Women Voters. And the answer was yes. She said, I'm quite sure that I'm right, and the answer is glyphosate. So glyphosate is Roundup, and as probably almost all of you know, Monsanto lost a lawsuit because they had suppressed evidence and data for over 20 years saying that it was completely safe. So the problem with Roundup, that this is, the red line is the rate of hospital discharge diagnoses of various children diagnosed with ADHD and the rate of rise of glyphosate applied to corn and soy crops in the USA. And both of these statistics are from the CDC. And this is the reference for that. And then this, I really like this one. This shows the autism prevalence, the red line, the yellow line with the glyphosate rise being the red line there, and also published by the CDC. So glyphosate modifies the bacteria in our gut. Bacteria possess pathways that we don't, and also yeast and mold, the same thing. So we're creating bacteria and viruses that are resistant, recognized as foreign objects by our body, and glyphosate causes increased intestinal permeability and also a leaky blood-brain barrier. So this toxin is lending to our more frequent diagnosis of ADHD. Now, what all this business about neural inflammation? So we've probably all been hearing a lot about cannabinoid receptors. Well, in the last 3 years or so, we've known about certain genetic markers, putting them all together, and there are commonalities. And for example, some people have very aggressive inflammatory responses. So on the left of the screen, you see C3, CD14, and then all of these interleukins from IL-2 down to IL-13. These particular genetic markers are what we call broken on switches for inflammation, meaning that if there is a virus, bacteria, fungus, biotoxin that is introduced to someone's body who has abnormal on switches, they have an aggressive and inflammatory response. Severe allergies, eosinophilic esophagitis, sinusitis, pneumonia, ear infections. So when I hear of kids and adults presenting with those, I always think about these broken on switches. Then on the right are what we call broken off switches. We've all heard of tumor necrosis factor alpha, and that if you can inhibit TNF, then you don't get destabilization of the mast cells and release of histamines, but also the leukotriene pathway. So if you can treat TNF-alpha with curcumin and BioPerine and stinging nettles and quercetin, those are some of the agents that will block TNF. There's a whole myriad of those. But if you also have broken off switches, that's where you really run into trouble. So say you have a kiddo with ADHD. They've got some broken on switches on the left, broken off switches on the right. They're exposed to some inflammatory triggers, but they can't turn off the inflammation. That means that when these foreign invaders enter the body, all of these broken off switches, which are on different types of receptors in our body, you have a cascade of inflammatory cytokines that are produced by broken on switches, but the broken off switches, you cannot dial back the inflammation without intervening and giving the patient alternate off switches for inflammation. So our different receptors that release inflammatory cytokines are opioid, endocannabinoid, and cannabinoid receptors. So you can modulate those by, of course, high-dose omega fatty acids, a good ratio of EPA to DHA, and then also since phosphatidylcholine comprises about 50% of cell membranes, it's also very useful. You can use low-dose naltrexone topically or orally. I usually start with 0.5 milligram topically in infants from 0 to 1 year of age, and then I ramp up to usually 4.5 milligrams with it just depends on the clinical presentation of the child or adult. You can also use something called palmitoyl ethanolamide, or PEA, to modulate inflammation at something called PPAR, or endocannabinoid receptors of the microglia in ADHD. And lastly, you can modulate the CB1 and CB2 receptors. And all of these receptors, opioid, endocannabinoid, and cannabinoids, they release inflammatory cytokines. So you can use CBD oil. But if there's a question of mold or mycotoxin illness, you don't want to use CBD oil because it can cause a potential glutamate storm. So if you use CBD on someone and they get worse, they get anxious, or they feel like they're crawling out of their skin, or their sleep does not get better and it gets worse, think, oh my, I may be causing a storm of glutamate anxiety in their brain because they've got mold or biotoxin illness. So you can use, for CBD, you can use an oral liquid, a cap, a cream. Okay, now this is a genetic marker that shows us that sugar ingestion increases the risk of hyperactivity. So Dr. Feingold, who said stay away from all these things, and everybody said sugar has nothing to do with it, well, he was right and they were wrong. So this particular genetic marker, and I put the reference sequences in there, increase the risk of hyperactivity when you have sugar. And we all know that sugar is inflammatory. Next, you can always use natural anti-inflammatories, which I noted earlier, but you want to eat high-dose antioxidants or consume high-dose antioxidants such as omega-3, 6 fatty acids, curcumin with BioPerine, which activates something called the NRF2 pathway, and polyphenols, high-dose vitamin C, ECGC from green tea extract, resveratrol from grapes. You can eat the color of the rainbow of antioxidants, fruits and vegetables, and the color of the rainbow. The rainbow is not Skittles and M&Ms. And you basically need to get all these kids and adults off sugar. Now, these are some neurotransmitter markers to know. You'll notice here the second and third one are two GAD1 markers, and the two bottom ones have to do with serotonin receptors, and then COMT, everybody's heard about that. lends to anxiety, and then also recycling of estrogen. And then MAO-A and MAO-B. MAO-B, if you're homozygous for that, you're most likely going to be in clinical depression. So when you have GAD1 SNPs present, you need to be very careful with any L-glutamine supplementation. We're all taught to use L-glutamine to heal the gut, but if you have these GAD1 receptors, you can drive glutamate higher, and that can in turn cause more and more anxiety. So you counteract GAD1 SNPs with high magnesium, zinc, glycine, B6, and adaptogens like L-theanine, valerian, and kava to relax and calm the wired and tired mind. Now, genetics, there's a lot of great companies out there. Hardly any of them have all the neural inflammatory and external inflammatory SNPs present. You need to shop carefully, and we all have our favorites. So the balance of neurotransmitters, we really need a nice balance of excitatory and inhibitory neurotransmitters in the brain and body to keep us calm and focused. So glutamate is the most prevalent excitatory neurotransmitter in the body. Other excitatory neurotransmitters are dopamine. Dopamine is excitatory and inhibitory. Acetylcholine, norepinephrine, epinephrine, those are more of the excitatory ones. And glutamate needs to be balanced with GABA, gamma-aminobutyric acid, and that's an inhibitory neurotransmitter. So if you have too much glutamate, your brain runs at an exceedingly high speed, and it's really difficult to turn your brain off. So a lot of these kids will present, or adults, they'll lay down at night and they say, I just lay there and my brain just goes 90 miles an hour and I can't turn it off. And they're exhausted. These kids may become hyperactive, then inattentive, have very explosive behavior. They go because exercise makes them feel better because they're making endorphins and metenkephalins, but then they get super inattentive and they just turn off, and then maybe they fall asleep exhausted. So eventually the brain just starts to wear itself out if you can't convert glutamate to GABA because there aren't adequate off switches. So patients and children complain that they're tired, but as I said, they lay down and they can't go to sleep. So inattentiveness, spaciness, especially as the day goes along, they can't shut their brain off. A lot of these kids and adults have really tight muscles, muscle spasms, and constipation also typically are present with the inability to make adequate GABA and have it in balance with glutamate. So GABA relaxes the bowels, but too much glutamate causes muscle spasms. So these folks are a lot like glass half empty kind of folks. They have dysphoria, which is things just aren't quite right. So in order to be able to make GABA, you must have normally functioning GAD1, glutamic acid decarboxylase 1 enzymes. So GAD1 is one off switch for a brain that just won't slow down, and the brain's on fire. So I like to think of folks that have this, a lot of times they're glass half empty, like Eeyore from Winnie the Pooh, and, you know, nothing's ever right. They always find something to complain about. You know, if they get better, they can't see the joy in things. You know, it's just like they always look at the world glass half empty. All right, now this slide, unfortunately, isn't really big, so you might want to blow it up a little bit. But why don't we give people with GAD1 receptors GABA? And if you've tried giving GABA to people, they get better for a couple of days, then they get worse. Well, the problem is that glutamine is metabolized via the mitochondria to glutamate, then converted to GABA. The GABA is put in these little vesicular transporters. It goes into the synaptic cleft, and then the GABA then goes back through the mitochondria, converted back to glutamate, and then converted back to glutamine, and the cycle goes over and over again. So when you give GABA, it's converted back to glutamate, and if you cannot slow that turnover down, you run into trouble. So this is a really busy slide, but there's several things I want you to see. This is called the NMDA receptor, N-methyl D-aspartate receptor, and it uses magnesium, zinc, and glycine as cofactors. So up on the right, where you see the little Pac-Man in the gray things, you can see zinc as a cofactor. Then in the middle, you can see magnesium, and then in the magenta and red Pac-Man on the left side of your screen, you can see glycine, and then there's also D-serine there. And as you can see, those are cofactors in the NMDA receptor. So when GAD1 polymorphisms are present, common deficiencies are as follows: magnesium, zinc, glycine, glutamate, glutathione, glutamate, just think glutamine. So the glutamine burns out after a while. So once again, I don't recommend supplementing with L-glutamine for patients with GAD1. So you need to be really careful, or you can make them more anxious and inattentive. Amantadine is another thing that you can put in your hip pocket for people and children that are severely inattentive and disruptive, and that you've done their genetics and you know what their GAD1 markers are and all the other neurotransmitter markers. But it's a great old-fashioned antiviral. It was used to treat influenza A, but it binds to the NMDA receptor. And if you go to PubMed and Google NMDA receptor antagonism and amantadine, you can use that in your hip pocket. Just today, I saw a little boy that has these GAD1 markers, and he is just all over the place. But he goes and goes and goes and goes, and then towards the end of the day, his parents look at him, and it's like he's got a deer in the headlights. He's very emotionally labile, and he just collapses in bed. And so we're using high-dose magnesium, glutathione, and pyridoxal 5-phosphate, which is vitamin B6, because it's also one of the things that he's depleted in. We're going to try that, and we're also going to use a supplement that has, it's got a little magnesium, glycine, zinc, to bind into that NMDA receptor. So it's a great supplement. All right, so the dopamine and hyperactive inattentive child. So when we think of this type of ADHD, we think of impaired executive functioning and a lack of dopamine. So dopamine is the primary neurotransmitter that helps us with short-term memory, focus, concentration, organizational skills, sleep stability, mood stability, and hormone regulation. So typical low dopamine, you're hyperactive, running around and restless, and you just need to get a good balance of that. So everybody talks about methylation, but methylfolate is used to make dopamine. And you can see that here, but the methylfolate also controls and has, it doesn't control, but has influence on all the items at the top with inflammation, mitochondrial weakness, neural healing, immunologic problems, hormone issues, and poor detox. So dopamine is manufactured in our brain from tyrosine, and prior to that, phenylalanine converts to tyrosine. You have to have adequate iron for dopamine production, and you also need an adequate supply of amino acids. Glutamine is an amino acid, and we're going to get a certain amount of it in our food, but instead of using high-dose glutamine in these kids that have the previously mentioned GAD1 SNPs, you just need to be really careful. Now, ferritin is a storage protein for iron, so if the iron goes low, the ferritin also goes low. So in order to convert tyrosine to dopamine, you need tetrahydrobiopterin. And so it's converted to dihydrobiopterin with the assistance of methylfolate, which is bioactive vitamin B9. So that's important. And then zinc is required for the conversion of dietary pyridoxine to the active form or the methylated bioactive form, pyridoxal 5-phosphate, which is necessary for the conversion of tryptophan to serotonin. So they're all interrelated. So activated B6 is one of the, or pyridoxal 5-phosphate tends to be low on micronutrient deficiencies, and you need to use methylated B6 in conjunction with magnesium to help, but that's been shown to be as effective as Ritalin to raise serotonin levels. And you also need to have the entire methylation pathway, not just little pieces of it. Everybody makes such a big deal about MTHFR, but you can be MTHFR negative and have a profound methylation deficiency. So we know that low levels in pregnancy are linked to hyperactivity in children, and so you need to know the 7 enzymes, the folate receptor 1, and here's another typo, it's supposed to be folate receptor 2, dihydrofolate reductase, MTHFS, MTHFD1, and then the 2 MTHFR SNPs. So here's an example of the entire methylation pathway, which you really need to know, not just MTHFR. Okay, so these are from a booklet on the various micronutrient deficiencies that you can see, but B6, magnesium, zinc, carnitine is important because it has to do with the fatty acid shuttle involved with the mitochondria, and serine is part of the NMDA receptor. And there's glutamine. Choline, phosphatidylcholine, as I said, composes 50% of our cell membranes. And then all antioxidants can be low in addition to folate. Because you've got this little fire, you've got to turn the fire down. And so the SpectraCell tends to go low. And these are references for those micronutrient deficiencies. And here is a great summary page on the various micronutrient deficiencies you'll see also. Now, I just mentioned this. We're going to kind of buzz through some of these quickly because we're running a little close on time, and I want to allow a little bit of time to do some questions. Let's see. Another note on this type of ADHD, we typically think of the little second-grade boy running around. As we've learned more and more about PANS, which is pediatric acute onset neuropsychiatric syndrome, and PANDA is a subset of PANS, which is pediatric autoimmune disorders associated with strep, a commonality is seen in the presentation of children with this type of ADHD, and the number of children and or adults, I treat several adults that also have autoimmune neuropsychiatric syndrome. They have anti-dopamine receptor D2L circulating autoantibodies on their screens. So they carry the diagnosis of both autoimmune encephalitis and ADHD. So my thing is, all right, the underlying issue is the inflammation. All right, fatty acids are very important. You have these references, DHA and EPA, and so basically the micronutrient anti-inflammatory supplementation and medication summary. Treat the inflammation first. Consider CBD, but not when mold is suspected. Low-dose naltrexone, palmitoyl ethanolamide, you need to have that sourced from Switzerland or Germany and make sure there's not toluene used in the extraction process. Individuals with GAD usually do very well with supporting the micronutrients on the SpectraCell report, but they also tend, without GAD1 variants, like the hyperactive and inattentive, just the hyperactive, impulsive predominant form, tend to respond well to stimulants if in crisis, and you can use those short term. Individuals with the GAD variant should not have L-glutamine in high amounts. And we're usually treating the gut, and that's what we use, but it tends to backfire. Don't use GABA because it'll work for a few days, and then it'll backfire and get converted back to glutamate, and they'll get worse. Use lots of anxiolytic supplements, magnesium, B6, zinc, omegas, turmeric, BioPerine, and later on support with methylation. So remember, you want the healthy foods that you see on the left. This is the diet that everyone should have: organic, non-GMO, plant-based, and anti-inflammatory, meaning possibly avoid, I would avoid gluten and casein and gluten cross-reactive foods too, which immunologically resemble gliadin. So that can be corn, dairy, rice, oats, yes, even gluten-free oats, millet, and yeast to the immune system. The body thinks you're still eating gluten. And certain foods can activate opioid receptors, such as gliadin and casein. They cross the blood-brain barrier in the form of gliadomorph and casomorph, which are short-chain opioids, and they're addictive. And you literally go through withdrawal for 3 to 5 days when you remove those from the diet. The anti-anxiety diet is fantastic by Dr. She's not a doctor. She graduated from Bastyr. She might be a naturopath, but I know she's an RD and an LD and a CDE. So great book that she's put out, and she's coming out with a cookbook in September or October. Take your kids shopping, teach them how to cook, and you want to have more alkaline food choices on the right-hand side of the chart. Consider growing foods if you can, and gardening is free. You want to eat food that's Roundup free. You want to go barefoot in your backyard. You need vitamin D and antioxidants from your sunshine that you're going to get when you're out in the garden. And if you're in the Houston area, these are 3 Butcher Box online market can deliver fresh meat to your door, but the other 2 farms are great organic farms in our area around Houston. So you want to shop the periphery, and these are the places to go. And this talks about the types of fruits and vegetables. Go to environmentalworkinggroup.org. It will tell you about healthy food choices. Some other good information here. This is from Dr. Peter Osborne. Talks about the types of sweeteners to use. Dairy, cows have 4 stomachs. We don't have 4 stomachs. We don't ruminate, so don't drink milk. And this talks about environmentalworkinggroup.org, and you can get a phone app. Take cell phones away from your kids or get an EMF cover. The adult brain, the skull is thicker. This is a cell phone applied to the ear, and in a 5-year-old brain, you see how the electromagnetic fields, when the phone is applied to the ear, it goes all the way through the brain. This is the rate of glioblastomas, as the rate of cell phones have gone up in the U.S. And then you can also buy your own EMF meter. And this is the mission of my practice, to optimize the wellness and longevity of our patients and their families through root cause analysis and holistic care, physical, mental, emotional, and spiritual. And these are our core values: integrity, humility, optimism, people, and excellence. And this just came out on July 17th, It's an article that talks about GABA and inhibition and glutamate in the brain, and I thought that was fantastic. It just came out on Medscape and the Journal of Neurology, and that's the mark there. So I wanted to thank you for your time today, and I'm going to switch over to Q&A. So let me see. Methylfolate makes dopamine. What if a patient has an MTHFR gene mutation? Well, it's not just MTHFR. It is the entire pathway. So you really need to know that, not just MTHFR, because you can have an MTHFR mutation, but have some function. Okay, if a micronutrient test hadn't shown the deficiencies you referred to, is the supplementation still recommended due to the symptomatology? Well, you really need to dig a little deeper. You're going to want to get genetics on that person, because if you're not showing those deficiencies, not everyone, all of our genetics are different, so our micronutrient deficiencies are going to be different, and our diets are also going to be different. So that's one of those things. So can you discuss the role of histamines if undermethylating histamine or mast cell activation, the excess histamine seem to affect attention and anxiety as well? Okay, that is a loaded question, but what I could say is that there are actually several genetic markers, 3 that I can think of right now. And when you see mast cell activation and excess histamines, you need to identify those genetics. And usually mast cell activation is tied into biotoxin illness, specifically mycotoxin illness. Any thoughts on specific probiotics for ADHD? I really like spore-based probiotics for ADHD because they modulate the gut by scavenging lipopolysaccharides, which cause inflammation in the brain. Also, Lactobacillus rhamnosus is very calming. All righty, I guess next question. And let me see here. If it's unknown if they are GAD1 or not, is it reasonable to just treat without the glutamate and see if they improve? Absolutely. Could this give us info to consider the stimulant later? I would do pharmacogenetic testing on a patient if they had issues with, if you wanted to use a stimulant. I would not use pharmaceuticals until you do pharmacogenetic testing. All right, last question. How much P5P in general should you use? All right, activated pyridoxal 5-phosphate. I usually start with 50 milligrams in the morning, and I use that in conjunction with high-dose magnesium for about a week. And if after a week the anxiety has not decreased, then I go up to 100 milligrams of pyridoxal 5-phosphate. You do not want to use pyridoxine because if you take that, you can develop paresthesias. That's the non-bioactive amount, the non-bioactive form. Okay. I also recommend Epsom salt baths for these kids, and you do a cup of Epsom salts to a cup of baking soda, and that tends to be calming. Okay, so our time is up, and that's our last question. And all right.
Thank you,
Jessica.
Yes, thank you, Dr. Kruppstadt, for a wonderful presentation.
Okay, well, thank you very much. I really appreciate it, and I appreciate the privilege of being able to present. So good luck, and thank you so much. All right, take care. Bye-bye.
This now concludes the webinar. Have a wonderful evening. Good evening. Welcome to SpectraCell's Thursday night webinar program. We're excited to bring you ADHD, Transformative Insights and Treatment Strategies presented by Dr. Paula Kruppstadt. Slides and other educational materials are available for download in the resources box on the left of your screen. You may submit questions in the Q&A box, and if time permits, we will answer these at the end of the presentation. At this time, I would like to welcome Dr. Kruppstadt.
Thank you very much. I appreciate it.